somebody's head and fix it again. Because he can always believe that I can do all things. Even when I am even doubting my... In fact, the time we are writing primaries is an exam you wrote after the... And we were about writing primaries. One day, I was reading. I thought I said I should go and sleep. That there is nothing that will make me not to pass. I said, do you know the question they will say? He said, even if they go to the moon and bring question, you will pass. You would have been reading every day. Go and sleep. And sometimes you go in with that conviction. And by the time you go with that conviction, you always come out victorious. The idea is that the moment this child come out, why you are still carrying the child on the hand? I'm not a pastor, but even if you don't prophesy on the child, always convince the child that he can do all things. I don't know if you understand. That now take us to the grandmother that comes, your mother that comes, and your mother-in-law that comes. By the time this mother comes, try to look at the principle they bring. If that principle they bring does not affect your own principle on the child, it's okay. Whatever they tell you, you do it. Let there be peace. Provided that it is not harmful to the baby. Don't come and prove to your mother that this is old stock. It is that same old stock that he used to train you. I don't even understand. A child might be having hiccups. And provided there's nothing they give you, your mother might tell you that if you bring out the cloth and put on his head, that hiccup will stop. You will start telling him no, it will not work. Once that thing will not harm the baby, we don't lose anything by removing it and putting on top of the baby's head. It doesn't make any difference. I don't know if you understand. Or he's telling you that the child is crying, you will start touching him here. You say no, you must give paracetamol. It makes no difference. Do that thing that he told you. But there is some that the child might be having an eye discharge. They will now say you should bring out your breast and put on the child's eye. You know this thing might injure the eye. You now tell him, Mano, let us go to the hospital. But there might be something that she might be telling you to do, which might not hurt the baby. I don't even understand. Just agree with him. Do that small one. But once he reaches the stage of putting it in the baby's mouth, or in the baby's eye, or in the baby's nose, no. Is it clear? Then you come to the mother-in-law itself. This mother-in-law might always be awake all the time. The baby is crying. The mother-in-law is not resting. Once in a while, check the mother-in-law's blood pressure, or check the mother's blood pressure. They might have important hypertension, small in the village, and nothing is happening. By the time they now come to your house, they are not sleeping. They always babysitting. The BP might go so high. And in that case, we have some issue. So once in a while, try and bring that mother or mother-in-law to the hospital. Even if not for a full checkup, let's check the blood pressure. Let's check the blood sugar. That might be all we might need. And it might not even cost you more than 1,000 or 2,000. You might just bring the woman and say, I don't want to get scarred. I just want to check her blood pressure and her sugar. I don't know how much they used to check blood pressure and sugar, but I know it's not up to 1,000. And after that, it might be the time of immunization. When you are going for immunization, just take this woman along. Check the blood pressure, check the sugar. If it is normal, it's okay. Any other thing you want to do, you can do later.